Hey there, dog lovers. I'm Dr. Karen. During COVID-19, online and telephone consultations became a necessary part of both human and veterinary medicine. And although we're no longer in lockdown, it seems that online vet consultations are here to stay. There's no real substitute for a hands-on in-person examination. But the ability to speak to a vet about a minor illness or injury, a follow-up appointment, or to decide whether or not an animal needs to be seen as an emergency gives owners a lot more freedom and flexibility when it comes to looking after their pets. One obvious limitation, though, of a virtual consultation is that we, the vet, aren't able to physically examine your pet. So that means we're going to be limited as to what we can diagnose and assess. So the more information that you can give us, the better. So I'm going to show you how to perform a basic health check of your pet right here at home in less than 10 minutes. This isn't a replacement for a physical examination at the vet, but it is a way for you to provide some more meaningful information to your vet, as well as to be able to monitor your pet's health at home. The only things that you're going to need to do this health check: a thermometer, something to lubricate that thermometer with, a pen, a watch, and this examination checklist that you can get by going online to dogster.com. So let's grab our volunteer and start our 10-minute health check. With the help of Freddie here, we're going to work our way through the examination checklist. So the first part of our examination we call the TPR. It's sort of our hallmark of an examination or checking a patient. It stands for temperature, pulse, and respiratory rate. The easiest ways to check your dog's heart rate without using a stethoscope are to check some of the prominent pulse points. And one of those sits right here in the jugular groove, and we're feeling the carotid artery. Another way you can check the heart rate, and this is particularly useful on lean animals, because sometimes you can actually see it, is putting your hand on the ribs on the left-hand side, just behind the shoulder and elbow there, and you should be able to feel that heartbeat. And the third place you can check is their femoral artery, and that is sitting just in this location here at the top of the thigh on the inside there, and it's something that you can do fairly easily with them just standing nice and still. Respiration rate is going to vary throughout the day, so the best thing to do is to wait for them to be resting or sleeping to measure that. And these are both measured in beats per minute. When you're doing heart rate and respiration rate, it's often easier to just take a measurement over 15 seconds and multiply that by 4. But if you want to have even better accuracy, then take the reading over the full 60 seconds. The next thing we're going to check is our gums. The color of our gums and something called capillary refill time tells us quite a lot about what might be going on in the body, including blood pressure, anemia, blood loss, and hydration status. You're going to lift up that gum, and we're looking at the color first of all. If you've got a dog with pigmented gums, you will usually still be able to find a spot where it's not darkly pigmented where you can check that color. So what we want is it to be this nice salmon pink color. There's going to be a little bit of variation there, but it shouldn't be really pale and it shouldn't be really dark. When you feel the gums, they should feel moist, not tacky, not sticky. And to check our capillary refill time, what we do is we push the gum, which will blanch the color out of it, and time how long it takes for that color to refill. And that's usually somewhere between 1 to 2 seconds. Lift up the gum, the lip, so we can look at the gum. We push on the gum, and you can see that refill happens in about just over 1 second. That's perfect. Taking a temperature. This is something that is best done with some assistance. need to place some of the lubrication on the tip of our thermometer, make sure it's on and reading, lifting our tail, going into the bottom, angling it slightly to one side so that it is in fact touching the wall of the rectum, and then we've got our perfect reading. Good boy! With an eye exam at home, we're not going to be getting too complicated, too technical. What I'm looking for is, are they roughly equal in size and shape? Does one look bigger than the other? Are they red? Are they cloudy? Basically anything that stands out as abnormal. When we look at the pupils, are they equal? In light, the pupil should be around about 1/3 of the diameter of the iris, or the coloured part of the eye. And if you turn the lights down, we should see those pupils dilate or get bigger. One of the things we like to check is something called the dazzle reflex. Now, you can use a torch or even a torch on your phone. And what we're going to do basically is, if we turn down the lights and flick it in their eyes, like that, we expect them to blink. That's our dazzle reflex. We're going to then check something called menace, and that's a visual test as well. What that involves is we cover one eye and we come at the other eye like that. We do that on the other side as well. And that's testing the reflex. That means that if anything comes toward the eye, they're going to blink. The last thing we're going to have a look at with the eyes is, are they comfortable under some pressure? Not a lot of pressure, just some very light pressure. And that gives us an idea of things like glaucoma. Is there any pressure building up in the eye itself? So with the eyes closed, you're just going to put a little bit of gentle pressure on each of the eyes. If they feel really quite firm and there's no give, or if your dog is shying away and seeming painful, then we've got a problem. So next on the checklist, we're checking things like our appetite. Is there vomiting? Is there any diarrhea? And we're also wanting to have a bit of a feel of the abdomen. Is it relaxed when we're feeling it? Is it soft? Or are they flinching? Is it hard? Is it tender? Next, we're going to do a quick examination of the skin. So we're looking at ears. We're just having a look at the coat and at the skin. We're checking between the toes. Checking under the tail, around the bottom area. We're looking for any redness, any bald patches, any flaky skin, any crustiness, any scabs, anything like that that's unusual. This is also a great time to look for any lumps, any bumps, any swellings. Having a feel underneath the jaw, down the neck, over the front, under the limbs, down the backs of the legs, and just checking for any lumps, anything that seems amiss. So finally on the checklist, we've got our musculoskeletal examination. We do need to focus on their gait, or how they're walking. Are there any lamenesses? Does it seem like they're having trouble moving any of their limbs? Do they seem to be stumbling? Are they scraping any nails? Anything that stands out as abnormal. Another thing we want to check is our neck movement and comfort. If you are at all worried that they could have a neck or spinal pain or injury, this is something either best left alone or done very, very carefully. So we start by putting one hand underneath the chin, steadying it over the shoulder and tipping the head back to have a look upright. We then put a hand over the top of the head and bring the nose down to the chest. We're then going to move the head all the way around. Now, that nose should ordinarily be able to virtually touch the chest wall, but you need to do this slowly in case there is any pain or any problems. And that's perfect. If we're looking for any spinal pain, working our way from the base of the skull backwards, you're wanting to use sort of a flat palm or flat fingers, working your way down, using pressure that's firm but not too firm. And we're coming over, feeling on both sides of the spine. Put a hand just to steady underneath the tummy, otherwise most dogs will sort of naturally drop down as you come further down the back. So what we're looking for is, particularly around this area here is where we tend to get most back pain, is as you're coming down putting pressure here, we're looking for either a dog looking around, or you're looking for flinching in these muscles along here. So if you see any of that, that's an indication that there might be some pain going on. Again, they won't always cry out, so you've got to look not just at the area you're feeling, but you've got to watch their face, their reaction as well. So now we're going to move on to examining our limbs. And again, this is an area where we often hear owners say that they're limping, but they don't seem to be in any pain. Dogs only limp if they have got pain or a neurological issue with the limb. So often the pain is there, we just need to find it. We always start systematically, starting at the toes and working our way up the limb. So you're going to start by having a feel of each toe, then having a feel of the paw, flexing that carpal joint, extending that joint, flexing the elbow, extending the elbow, extending the shoulder, and then flexing the shoulder. Moving on to the back leg, we're going to do the same thing. So feeling each toe, flexing the ankle joint, extending the ankle joint, flexing the knee, extending the knee, flexing the hip, and extending the hip. Now this is probably one of the more common places you're going to see a reaction. It's probably one of the places that you actually might even get a dog cry out if they have some arthritic pain in that area. And whilst you can see on Freddie, I can get that leg basically horizontal with his back. If you've got an older dog that has some arthritis, particularly if they're a breed that may have some hip dysplasia, be very careful. You may have some dogs that you can only get that leg coming back about that far. So again, that's something to take note of. The final thing we're going to check for is something called conscious proprioception, or CP for short. Basically, it is telling us if there is normal communication between the foot and the spine, and then onwards to the brain. You're just going to put a little bit of support under the tummy there. You're going to pick up that back foot, flex the toes underneath, and place the foot like that. And he has done a perfect job. Basically, that reflex should be pretty much instantaneous. I'll try and hold it in place so you can see it a little bit better. If you've got a delay in how that is placing, it doesn't necessarily give us a specific diagnosis, but it's particularly useful for dogs where we're worried about spinal or disc injuries. So hopefully that gives you the confidence to perform a basic health check on your pet at home. But remember, there is no substitute for a physical examination with your vet.